So, ma'am, how are you? How things going?
Congratulations, Dr. Jahangir.
Yeah,
Wonderful,
ma'am. Thank you
wonderful
very much.
journey. I must say, tremendous. We're all here just to listen and learn from your experience.
Ma'am,
So superb.
I just yesterday I have finished my journey of examination. I passed UK driving test as well yesterday.
Wow, great. Congratulations. One
Congratulations.
more, one more.
In third attempt, ma'am. In third attempt. First two
That's
attempt
all
I
right.
failed.
Dr. Jahangir, streets are very narrow in UK and you have to learn and
Ma'am,
think
I was
different
just
systems.
amazed, but I passed FCPS first chance, MRCS first chance,
I know.
but in driving test I took third chance. I have to
That's
appear
all
in third
right.
time.
It happens, you know.
But the most that's why there are very low accidents and in
Yes.
England because
People
their driving
respect
test is
each other, yes,
so tough,
in traffic,
so
yes,
restricted,
yes.
and driving license is so much valuable here. With one driving license, you can do everything here. This is the identification card. This use everywhere.
Were
So
you using your international driving license before when you were picking
yes, ma'am.
your family?
I drove
Yes,
1 year with international driving license.
good.
And that's why, ma'am, in my country. I had my own car. I drove 5 to 6
I
years,
know, I understand,
and
yes.
I drove UK 1 year with international driving license. Even though I have failed 2 times. That's the funny thing.
But Dr. Jahangir, this driving license is accepted in all over the world.
Exactly,
Even if
ma'am.
you'll travel to Australia, they'll accept this driving license. If you travel
Because
to
this is so tough,
USA,
they
so
had to
it's
accept it everywhere.
internationally recognized driving license.
Yes,
Even
ma'am.
if you'll come here in Sweden, you can just show your license and you can hire a car. So they'll accept your driving license even here. So it's internationally recognized. So congratulations.
Thank
It's
you, ma'am.
worth it. It's worth it.
Yes,
Third time
it's
worth
worth it. I was so happy that last night I couldn't even sleep with excitation. I was so excited that I got passed on this exam.
We are also happy for you.
It was like a, and ma'am, now I'm happy to discuss a lot of things with my dear friends and fellows.
Yes.
With your kind permission.
Yes, sure.
Yeah, please.
And ma'am, what about the last result? Last session, the students who appeared the exam, what about their result?
Almost everyone passed except for one, for which I was really heartbroken.
Yes, I am
All the
also
others,
heartbroken. I can understand that. She told me
yeah,
only 1 marks.
very
Only 1
close.
marks.
Yeah.
Why Allah taking her so much
I
exam?
don't know.
She's a
Yeah.
brilliant lady. She's a brilliant girl, very good, nice girl. But why Allah is taking so much exam on her?
I don't know. It's everyone has their own time written by
I was
Lord,
just shocked, ma'am. Only for 1 number.
Yes, I know. That's luck.
That's luck because I passed only with 1 number, ma'am. My pass mark was 110.
That's
I
all
got
right. Yeah,
111.
that's what I'm saying. It's luck. Some people,
Hard luck.
time written for everyone, and we don't know it. We are just trying. Everyone is trying, and then we don't know whatever is written for each and everyone. Some people, they book the exam, and then something happens, and they end up canceling their exam. So it was not written for them even to appear in the exam, and some even go there and they cannot appear. So it's many people, many stories. Everyone has their own experience.
But she will eventually pass.
Everyone, yeah.
Because just it's a time. Time is. So,
Yes.
ma'am, I want to know one thing that those in my group at present,
Yes.
anyone is working in UK or not? Is anyone there working in UK, living in UK?
That girl was here. I don't know if she's working. Farah, no, she's not here. Yes, Dr. Vajia is working.
Yeah, I'm in the UK.
Vajia, where is you working now at present?
I'm in Reading, near London.
Okay.
Reading,
I will be
okay.
joining at
There is
Broomfield
another one
Hospital.
as well, yes.
Sorry,
Which one?
hospital?
Broomfield Hospital, Chelmsford.
Good.
Where is that?
Broomfield.
Where is it? Whereabouts?
Chelmsford. It's
Yeah,
near to London, 40 minutes distance from London.
That's good.
Yeah, I think I know where that is. So I'm in Sunderland.
Chelmsford, yes.
Okay, good.
And
Dr. Dio is
the
there as
best
well.
schools of UK is in there. So that's why I got 3 offers. That I choose that offer because I'm here. Everything is for my kids. So we wanted to shift there ultimately.
That's good.
And they have the best school there.
Yes.
So I want to start with one thing that first of all is there is a very good opportunity here, very good opportunity, and hope it will persist not more than 1 or 2 years. So those who are planning to come in UK to have a surgery career, so this is the time, this is the best time, and most of the people says that this is the golden time. And the people who are living here for last 10-20 years become consultant in this country now in a very good position from India, Pakistan or Bangladesh. They cannot imagine this thing about their time, that to join as a specialty doctor, as a registrar or as a locum consultant in this country, because at the time the things were very much difficult, the rules were very much tough. But now they have shortage of doctors as due to they came out from European Union, and as due to recent COVID. For COVID especially, they needs medicine doctors. But
Yeah.
in everywhere, they needs surgical doctors as well. So I think it would be better if you ask me questions regarding this
Yes.
thing, then I will answer.
Yes. I
Then that
have a
would be
question
nice.
from Dr. Ishfaq. He wants to know what's the probability to get a job for general surgeon. He came to know that it's difficult.
Mm-hmm. It's a there are a lots of factor related. It depends a lot of things. First, you have to understand how much capability you have, how much training you have. If you want to start surgical career here with zero experience from your home country, then it would be better to start with a pleb, very junior, start from this country. Then you will gradually go up and up. And it is those who are planning for MRCS, basically it is obvious that they have a few experience in field of surgery. So if you have at least 3 years in surgery, at least 3 years, 3 to 5 year would be good for a junior level like SHO, junior clinical fellow, junior post. It would be better if you have more than 5 years experience in surgery in your home country, then you will probably can try for register post, specialty doctor post, or senior clinical fellow post. But these things will depend. So with my experience and analysis, so I want to tell you everyone is one thing is that there is a lots of post vacant in the post urology. Listen to me very carefully. They have a lots of vacant post in urology. So I want to share my experience. I have applied in track jobs, 15 in post in urology, 15 post in general surgery. So then I got almost 5 to 7 interview offer in urology, only 2 interview offer in general surgery. Though I have huge experience in general surgery and some experience in urology, but they are offering me more and more urology post, and eventually I got an urology post. Why I took this urology post? Because first, uh, you don't need to decide that I will be an urologist and then I have to go to urology post. First, you have to come to UK. You have to get a visa. To get a job in UK, to get UK visa, it's easy to get a job in urology rather than general surgery. So once you will come in UK, and once you will practice 6 months or 1 year in urology, then you will have an UK experience. With that experience, yeah, then you can easily find a job in general surgery. If you want to go in general surgery, if you're going to hepatobiliary surgery, if you want to go in breast surgery, if you want to go in colorectal surgery, there are lots of division. So those who are now in a training, doing training in surgery, I will recommend you not to be stick with only general surgery. Have some training in urology as well. if you have 6 month or 1 year training in urology, then you can apply for a junior post. So is everyone
yeah,
listening, or I am speaking
No,
only?
we're
Nobody is
listening. With
listening.
respect, we're not talking. I
Dr.
thought the
Jahangir,
other way. Yes.
can I ask a
Yes,
question?
please.
Like,
Yes.
I think it would be
Dr.
better if you
Jahangir,
ask me a question, because
yes, yes,
I can speak so much that I can speak whole night with you.
yes. Thank you very much. I have this 3 years of experience in general surgery and one plus experience in neurosurgery. Okay, so
In
so
neurosurgery,
I
1 year.
1 year, yes, and in general surgery 3 years. So
Okay,
Dr. Irfan, you know him very well. He was my senior. He
but
graduated, post graduated from the same institute.
Dr.
Dr.
Irfan
Irfan,
told me that he will be in this meeting today.
Yes, buzz him.
but
He didn't come.
it's I think, ma'am, it is too late for him to come
Okay,
for
but he
this
did
session.
say yes.
Okay, okay.
Yes, ma'am.
Okay.
I know he's from the place. It's very difficult for us to get into this. It's very difficult. So, Dr. Jahangir, I was saying, like, is it possible to get into like general surgery? He was like quite struggling, as you must be knowing, to get a job from
Mm-hmm.
last couple of 6-7 months, and same is
Mm-hmm.
happening with my other colleagues as well.
Mm-hmm.
They are struggling to get a job from last 1.5 year.
Mm-hmm.
Last year, one of my colleagues they cleared MRCS and done with the general this DMC registration. And it's been 1.5 years. They are not getting any job in general surgery. So,
Yes,
do you
yes.
recommend?
If you basically stick with general surgery, it will be very difficult to get a job, because general surgery has very limited post, and in general surgery post they want someone those who have experience in UK, at least 6 month experience in UK. So if you have in any surgical field, it may be urology, it may be hepatobiliary, it may be blah blah anything. If you
Okay,
get at least 6 month experience, then you will able to have a general surgery post. So those who are now training, doing surgical career, don't train yourself only in general surgery. I was a general surgery. I was FCPS general surgery, but uh, I I practiced myself with urology as well, and I did the MS urology. I attended MS urology course. So you should have some diversity. You should have some lots of you should have lots of wings that you can fly with any one of them.
yes.
Okay,
So your recommendation is at least to get a 6 months experience of urology.
believe me, just urology now is so many posts in urology. You will easily get a job if you know only. Just let me explain in every point. Look, if you can do independently, if you can do testicular torsion surgery, it means detorsion and orchidopexy.
Okay,
And if you can independently do DJ stenting and cystoscopy, then you will
okay,
definitely get a job in urology. No question about that.
okay, great. So any idea
But
about
but
neurosurgery?
those
Like,
who are trained in general surgery never went to urology OT. Can never do a cystoscopy or DJ stenting, and they will not
uh,
get a job in urology.
I,
Okay,
I understand your
yeah,
thing.
but
Is there
this
this? Have you any idea about neurosurgery? Like,
I'm really sorry about that. I don't have any idea about neurosurgery.
okay, thank you very much. So you
But
recommend to,
but you have 3 years experience in general surgery. I think
yes.
stick with that. Neurosurgery is a subspecialty, so they will not directly take you to the neurosurgery. So if you can take an entry with general surgery, or
So still,
you can
I have this 3 years of experience in general plus 1 year of neuro. Still, I can't I can't get a job in neurosurgery.
no, not that the thing. You should look. You should start lots of things from now. That's why I came here today.
Okay,
Those who are preparing for MRCS B, ultimately they will complete MRCS B. Definitely, inshallah, if you stay touch, be connected with something, ma'am. Those who will
yes,
attend everyday session, those who will participate everyday session, they will never fail. If fails, then they will pass second time. Must. This is a tested and trusted,
right. Sure.
commitment to you. So
Right.
definitely you will pass. If you want to pass. If you don't want, if you attend sometime, blah blah blah, then nothing will happen. Then
That's right.
uh, and after MRCS, you will definitely appear OET. Someone someone completed OET before MRCS. So ultimately, you have to target your goal that I am coming to UK.
That's
So
right.
my recommendation to everyone, those who are die-hard coming to UK after their MRCS, now open an account in LinkedIn. LinkedIn.
Okay.
Open an account LinkedIn now at present that you are appearing in MRCS-B. You are a surgeon. You are doing general surgery, neurosurgery, urology. This make is your profile. There will be you can make a good profile of your. Then and when you will make a profile in LinkedIn, then you will send friend request to UK recruiting agencies. You will give a search recruiting agencies in UK. Then there will be lots of recruiting agencies. Then you will send them friend request. They will all be your friend by this time. But they will know you are preparing MRCS. Then when you will pass MRCS, then by this time you will have more than 25, 50 agencies. You will be connected with them by this time. And when you will complete your OET, then they will communicate with you. They will connect with you for job. But if you do everything after your OET, then you will be 6 months behind of that. One thing you have to be sure at that, those are coming from, I was in the UK. That's why it was very easy for me to get a job, and I had lots of experience. There's another point. So those who are not in the UK, in from Bangladesh, Pakistan, or India, or anything outside the UK, it is better to come through an agency. They can give you job more early, because in NHS and track jobs, you have to apply lots of application. Then, however, you may get selected for 1 or 2 interview, and you may not selected in the final interview. But if you get any interview through agency, you will surely be selected. This is a sure shot. So uh, if you open an account in LinkedIn from this time, then with your passing MRCS, it will take more than 6 months, and passing OET, it will take at least more than 1 year. So by this time, you will be recognized by lots of agencies. You will have a very good communication with them. And they but I got my job through trackjobs.com, because in trackjobs, to get a job in trackjobs.com, you should have to be senior. They prefer experience, more qualification, and if you have more experience, more qualification, more degrees, then they used to call you interview in trackjobs, nhsjobs.com. But in agencies usually make a commitment with the HR that I am going to bring one doctor from this country, and then I'm going to take this interview. If they sees your CV and agrees, yes, he is qualified, then they arrange an interview. And this is a sure shot. You will definitely get this job if you attend interview through agencies. So those are living outside the UK, I prefer them to make more connection with the agencies. Then how will you make this connection? You will make this connection through LinkedIn, because all the agencies are connected to LinkedIn. Okay.
Great.
So from tomorrow, everyone open an account in LinkedIn, open and make a good profile. The profile just you have at this moment up to this. Then when you will pass MRCS, then we will upgrade your profile. When you will pass OET or IELTS, then you will upgrade your profile. Okay. Then by this time, you will be notified by lots of agencies. Okay. Then ask me any question. I am speaking.
Hello, Bhaiya. I am Sadi. Hello, Bhaiya.
Sadia.
Hello.
Oh.
Hey, how are you, Bhaiya?
Alhamdulillah,
Hello.
fine.
Just want to know one thing. I have previous training in urology for 6 months. After passing MRCS Part B, if I come to go to UK, as a showing, there is a showing certificate, training certificate of urology.
You don't need to
and
show
after,
anything. They trust. If you say in your own voice, then I can do this surgery independently. They trust that. If your
Okay.
consultant is British, if your consultant is Indian, Pakistani, or Bangladesh, they will not trust you.
Okay.
No, ma'am.
No, I agree with him.
Ma'am.
Okay, yes, and yes, I agree with you, Dr. Jahangir, and especially in immigrants and female white.
Ma'am.
Yes.
I want to share a lots of things.
Yes, but she is doubtful, Dr. Sadia. Yes, I will allow you. Just a second.
Do you know this
yes, I know,
young
I'm
lady?
You.
Ma'am, do you know this Sadia?
No, I don't. She came to me with your reference. I
So
respect that. Yes.
Ma'am, remember this name. You will one day you will proud of this name.
Okay.
She's a gem. She's a gem.
Definitely, yes.
And
if you're
she
recommending,
passed,
I agree. Yes.
She's super talented girl.
Yes.
Yes. She was my colleague once. We used to study for FCPS in Bangladesh. She was my junior.
Part two course.
Very good junior, which I can proud of.
Okay, good.
She is my junior, but that much junior that whom I can proud of. She is an FCPS fellow in Bangladesh, and she is a very good surgeon. Main thing, she is a very enthusiastic, energetic, hardworking, and she never gives up.
That's good. This is what you need to be successful.
She never gives up. That's why whenever she just knocked me once, Bhaiya, I want to do Mrcs. Then and then Sadia, tell her within second. I gave you number, everything.
Yeah.
I always support her and encourage her. And I even talked with her husband as well. He's my elder brother. So everything is, we try to give her support. And she will, if she wants to come in UK, I can give you a promise that she will come within 6 to month to 1 year.
Definitely. Dr. Jahangir, tell them how to handle non-English interviewer, because when you go for a job, definitely immigrants are also well settled in UK.
Ma'am,
you can't guarantee that you will end up with a white male who will take your interview.
Ma'am, I want to share my experience. This experience is definite experience with my analysis.
Yes.
First thing, if you get any interview through agencies, you will definitely get this job. This job is for you. This interview arranged for you. But nothing here. If you cannot say anything in the interview.
This is rule number 1. Write it down,
rule number 1.
Yes.
If you can arrange an interview through an agency, this job is for you. This interview is for you. It was arranged.
Yes.
So whatever the interviewer, whatever the consultant is, it doesn't matter. That's why I want all of you to make a profile in LinkedIn, make connection with all the agencies, make connection with all the recruiting agencies. This is totally free. You don't need to pay anyone, and you don't need to pay any agency to any money. This is the totally free things. Okay.
These agencies don't charge anything from the
no, they will get the money from the NHS. From the NHS.
Okay. Yes, one must clear this.
If they can bring a doctor from any country to the NHS, they will get 4,000 to 5,000 pounds from that trust.
True. Okay. Good.
And another true thing is that, man, is anybody listening?
Yes, they are all listening.
Yeah, we are listening, Dr. Jahangir.
And they have a good connection with HR. You know.
HR. Okay.
Yes. So if you can arrange any interview through agency, this is a sure short job.
Okay. Cool.
Okay. Yes. Then my wife attended only one interview through agencies. She got job. My two younger brothers, not my medical juniors. I always say my brothers, like medical juniors. Both are coming. They all only attended one interview, all through agencies. Yes. But I attended interview through NHS or trackjobs.com. That's why I attended 4 and qualified in 3. Yes. I got no through agencies because I'm in UK, so I have lots of demand.
In the IMG group, they were discussing you, Dr. Jahangir, and I read your name. I said, "Oh yes, I know this fellow." They are discussing.
I always try to help people,
Yes.
because I understand that if someone prays for me, if someone get help, then it
Yes.
would be great for me.
How
I got
important are references?
reference is the vital when you will get job,
Yes.
because when you will get the job, they will contact you with the referees.
Yes.
They will definitely contact with the referees that whether this person has got this training from you, this person his character is good or not, how much attentive he or she is there anything against his or character, a lots of things they will ask you referees. So regarding your referee should not be a big professor. They don't care about this. Your referee should be a FCPS or MRCS consultant. More than enough. You should always choose referee with someone who is very kind-hearted, who is very much eager to write for you, who will be easily available,
Yes. Easily
who is
available.
easily approachable.
Yes.
Don't make anyone your referee, renowned professor of this country.
Yes.
The email will come to him or her. They will not
Even
recognize
reply.
this one, and your job will go on.
True.
Okay,
Very important.
how important, how big doctor he or she is, it doesn't matter. It just doesn't matter. It should be a fellow or member, MRCS or FCPS, a consultant. A simple consultant is more than enough.
True.
Means he is from my own country, right?
Definitely, where you got that training, the institute where you got the training.
Okay.
In that institute. Suppose you got your training in a medical college. There was a professor, 3 professor, 4 professor, 4 assistant professor, 2 associate professor, 1 consultant. You must have a very good relation with any one of them. It is not necessary he or she to be the main professor. If you had the good relation with most junior assistant professor, most junior consultant, you will write his or her name.
Okay.
Because
only one reference is needed, or more than once?
Two to three
two reference,
yes.
but they will contact with you, contract with the latest referee. Some trust contact with both of them. Some contract with them the latest, under whom you last 2 year, 3 year training you have done with this one. You has done with this one.
Okay. I have one question about like I am working in Saudi Arabia as a specialist orthopedics, right? So what are the prospects for orthopedics in UK after passing this MRCS? Like I'm doing all trauma surgery here. So
lots of possibilities, trust me. Lots of possibilities.
About the job.
About the job, there is
and
lots
further
of
development in career like this. Okay.
Look, everything is possible here, and everything is in the rule. In UK, you will see that everything goes in a rule. Nobody gets extra benefit. Nobody gets less benefit, like in our countries. So you will not be deserted. Whatever you will get, you should be happy with that, because everyone is getting the equal things. Yes, sometimes someone will be unlucky. That's the different thing. That should not be an example. Okay. But in Saudi Arabia, I don't think that you will have future, because you will not get the citizenship. If you spend your whole life after 60, 70 years, when you will have tremors in your hand, you cannot hold the needle holder. They will go to you back to your country.
They will kick you.
Citizenship, Dr. Jahangir, is one thing. I think about the pension. I don't think even he is entitled to pension.
And NHS pension is the best world class recognized pension. The month you get salary, and when you will go to pension, you will stay in your home, in sweet home near the beach, walking with your dogs, and you will see that every month you are getting 3,000-4,000 pounds in your card.
Do you know, Dr. Jahangir, how much percentage they deduct from the pay for pension?
Yes, ma'am. It's 9.5%.
Yes.
From your salary. They will cut 9.5% from your salary, but government will subsidize extra 20%.
Yes.
So you will get ultimately 29 to 30% from your salary.
Okay.
Yes.
And so I'll ask you one more question. Like
you can
after
decide
passing
not
this
to.
MRA.
not to allow them to cut for pension if you don't want
But
them.
yes, but
Yes.
it will not be a good idea.
Yes.
Okay. So I am asking you, like passing after MRCS, at what level I can get the job there? Means as a registrar or senior registrar or a
How many
specialist?
years experience you have
Like
in your orthopedics?
after post graduation, I have about 8 years experience.
You will
Wow.
definitely
in
get a
ortho.
register level.
Yes, 3 years training plus 8 years experience in orthopedics.
That's good.
You will definitely get a register level post. Don't worry about that. But if you don't get any register level post at the beginning, if you get any SHO level, clinical fellow level post, and don't get any register level post in 5 to 6 months after waiting, just don't bother for it. Post is not a matter here. The matter thing is that you have to get the visa. Whatever post you will get, and there is no
Job
that
visa,
much.
yes.
There is no that much discrimination of salary here. In our country, consultants earn 10 lakhs, and junior doctors earn 50,000. Not like this here. If an
Okay.
intern or FY doctors, uh, the girl who are working in UK, just ask her how much she is earning. She is definitely earning 2 to 3 lakhs in Bangladeshi taka, you know. So
Okay.
salary, if you get a junior post, they will give you that much salary that would be more than enough to run your family and to send some money to your country as well.
Okay.
But in your experience, you should get a register level post. I told you very specifically that if you have 3 to 5 years experience, then probably you will get junior level post. If you have more
8
than 5
years.
years experience,
Yes. 8
more
years
than
is a
5 years
lot.
experience, then you will get a
Yeah.
junior.
Over
So
7 years
I
experience. Even he, I'm sorry I have to interrupt.
yes,
Even he is qualified to give FRCS Part 1, Part A.
yes, ma'am. Yes. Ma'am, I want to and I want some questions from the very juniors who don't have that much experience. So I want some question from them. Yeah.
Who is junior? They can tell you themselves. Meanwhile, they are deciding. I have one question from Dr. Al Hassan. He wants to know that if he gets MD from his country and he looks for a CESR route, is it easy or is it that he has to do non-training job?
No, you can do both training job and non-training job. It's up to you. So it is my recommendation. Then first come training job will be very difficult from outside of the UK because they usually reserve the training post for the UK students. This is their priority. It's definitely this country's doctor. They are passing MBBS from this country, so they have the priority at first to get the training post. So after fulfilling the post from UK students, then they decide to give the training post outside of the UK. So it is very, very difficult to get a training post outside the UK. So my recommendation is that first come to UK with a non-training post, secure your job, get some experience in UK. After 6 months to 1 year, then you can apply a training post job. Okay.
Okay. Dr. Al Hassan, your question has been answered, or you can ask yourself if you want to know more. Yes, fantastic. So he's happy. Right.
Ma'am, Dr. Sadia, I want to ask Dr. Sadia, are you doing MRCS only to increase the bulk of your degree after your name, or you are serious to come in UK?
Actually,
Don't lie to
I
me.
am actually I want to shift to UK, but there are some difficulties here. Some family issue.
I
And
understand
some,
that because it would be very difficult for your husband to
yeah,
get a job in this country because uh, dental surgery is very difficult here, you know. So and then first do MRCS, then you will decide whether it will, but because you are doing
yeah,
very
yeah,
good in Bangladesh as well. Ma'am, she has a very good practice in Bangladesh. She's a very renowned surgeon.
That's good. I have a question. Dr. Osaf wants to know about the prospects of plastic surgery in UK.
Plastic surgery has very good prospect, and if you can become a plastic surgeon in UK, then, and if you are very young, you want to start from the very beginning of your training, and if you can become a consultant of this country of in plastic surgery, you will be one of the billionaire, not millionaire. Millionaire is nothing for a plastic surgeon. You will be a billionaire, because all the rich people here wants plastic surgery in private. So lots of money in plastic surgery, but
Yes, but
not the
is it
beginning.
easy?
If you can be a
It's
consultant, when you will be a consultant, after when you will be consultant, then you can do a private practice, and a lots of job in plastic surgery here. So my recommendation for those who are junior, first get a very good training in your home country. Don't spoil any of the time. Always involve yourself in training. The much you will know, the much you will confident in surgery, then much easier you will get a job. Because when the consultants will take your interview, by speaking with you 5 minutes or 10 minutes, they will be able to identify how much expert you are. The more expert and confident you are, then in surgery, especially in register level post, they will ask you what are the surgery you can perform independently. The name, when you will say the name of these surgeries, they will easily identify you how much you are qualified. Ma'am, I want to share one thing.
yes,
That was your country guy. When I saw the Muslim name, I was very happy that this consultant will be in my favor. Blah blah blah. I was very happy. Ma'am, his first question was that he said that looking at my CV, the number of surgery you have mentioned here, I didn't finish half of it yet. He said that. Then
yeah,
how can you can work under me?
yeah,
So you should be a consultant here. So I should work under you. So I said that now today I'm a candidate. I'm a student. I want to be a your student. Experience and age, it doesn't matter to me. How much surgery I did in my country, it doesn't matter to me. I have no experience in working in UK. Then again he said that, okay, you have so experience, you have earned so much money in your country. We know Bangladesh surgeons are very much rich. So why you have come to here?
yeah.
He's asking me this type of question.
He felt insecure.
He felt very insecure. Then
Natural.
he said that,
Dr.
okay,
Jahangir,
then
it's natural.
no, ma'am.
Men have jealousy as well.
Attitude was not natural.
Yes, I know.
It
So,
was,
welcome to the club. You know, once you'll deal with the people, you'll
yes, ma'am.
realize
You
someone you
have
never
mentioned this
thought.
thing 1 year ago. At that time,
Yes,
I
you
didn't
thought.
realize
Yes,
your agony. I didn't realize your pain.
yes.
Now
You'll experience
but ma'am,
once you'll
trust me,
start working, Dr.
the
Jahangir, and once you'll start operating
two
and
guy.
people will praise you, you'll face more.
Now I am joining in that the job. There, the interview was taken by two British consultants. They were
Yeah,
very young. Just they didn't ask me anything. They look at my CV. Wow, you have got so many surgeries. You are very experienced. Do you mind to work with us? His question is like that.
yes,
Nothing. He asked me nothing. Just I'm very much impressed with your CV. And could you please tell me what are the surgeries you can perform independently? Then when I started to say that, "Oh, enough. Do you mind to work with us?"
yes,
Within 2 to 3 minutes.
yes.
This was their attitude.
One is
And
luck, because sometimes even white males can be very annoying, but mostly 99% white males, if you come across with them, you'll get the job done. But if it's
ma'am,
immigrant or a female woman,
yes, British
white
people
female,
ask,
old, then okay, just imagine only 5% chances you can get the job.
but
This is
but
experience also.
people from India, Pakistan, and Bangladesh, the
They're hard.
consultants,
They're
they
hard.
consultants, no, they I told you earlier that I always wanted to a job in my wife's hospital. That would be better for me and for my kids as well.
Yes, whole family.
And
yes.
my wife's consultants likes her very much. They always wanted to keep me in their hospital because if they can offer me a job, then hopefully my wife will stay there. So my wife's consultant requested to the general surgeon urology consultant, please look on his CV and try to give him the opportunity. Then that guy called me for an interview. Then after my interview and after my all experience, he offered me that, well, I understand that you have lots of experience and you can do lots of surgeries, but you don't have any UK experience. So now I'm offering you attachment. First a few months you will work as an attachment, then we will decide what to do. Then this was his offer to me.
Yes.
I have to work in attachment, then after 5 to 6 months or whatever 1 year, they will decide whether they can give me a post or not.
Yes.
So
Dr. Roy has a question, Dr. Jahangir, for you. He wants
yes,
to know, he's
please.
got MBBS, MRCS, 3 years of non-training job, and what level would he enter?
He has completed MRCS.
This is what it's written here. Would he enter at CT1 surgery or ST3 ortho?
No, not ST3. Not 3 years, not ST3.
And then boost CV. Maybe he can read
ST1.
his question and he can clear it, because this is how
No,
I
why you are
understood.
looking for register post level means at the night you are the main boss of this hospital, so you have to that much mature.
Yes, but he wants to know how to boost CV. How can he improve his CV?
Let me see what he
Yes,
has written.
he has written here. ST1
No, I am not
surgery.
good at this thing. I cannot find anything here. Where
Yes,
is this written?
if you can look up here, I have highlighted his question.
Chat, yes. Someone has written the organ transplant surgery. Lots of posts in there. Don't worry about that.
Okay,
You have to
good.
be qualified. Post is not a problem here. They want qualified persons. If someone says that there is no post, I cannot get job.
What about gender-based discrimination? It's a girl asking you.
No gender here. Girls are.
No gender here.
Sometimes my wife says that sometimes in her duty she in her emergency duties, as when the consultant is not available, she is the boss, as she is also working as a specialty doctor. So she says that she is girl, her juniors are girl, sisters are girl, and then porters, those who are transporting patients, they are also girls. Sometimes she finds that. So this is a girl's world.
Yes. Dr. Al Hassan wants to know how he can strengthen his CV. What extra, because he's working in KSA, what extra
Look,
he can learn in his home country?
yes. Just Google, make some Google that the world's best CB or good CB, then you will find a lots of CB for doctors, CB for register level, CB for consultant level, CB for SHO level. Then you will find a lots of CVs there. From this you will, but I can recommend you one thing. If you go through track job or NHS jobs, they has a profile of CB. How to write a CB? They will give every question in a box. You have to just fulfill the box. So if you go through nhsjobs trackjobs.com, if you and open an account, then you will find how to make a CV. This is very easy, and I think you should follow this.
He wants to know different activities like how to do audits, etc.
No, if
He'll
you
get to
have
learn
doing,
that.
if you have experience doing in audit, but in our countries like I don't know about India or Pakistan, but in my countries
Doing
we have no
PSA.
experience of
Yes.
doing audits. So in my exam they asked me, do you have experience in audits? And I said that, well, audit is a very good thing in clinical governance. It's the most important part to increase the quality of service, health service. Unfortunately, I don't have this kind of experience. However, I'm very much interested to do audit. If you give me this opportunity, then I will definitely involve myself in audit. Okay,
Yes.
ma'am. Anybody listening?
Yes, and there is
Hello.
one question. Yes, yes, please ask.
Mr. Ricky, I wanted to ask what are the prospects of getting into a general surgery training program after doing 3 to 4 years of training job here in Pakistan or in your parent country?
Yes, you will definitely get a job. Don't worry about that.
No,
First,
but
you have to do.
yes,
First, you have to search for non-training job. Non-training job. When you will come UK with a non-training job, get some experience 1 year. And after 1 year, you can apply for training jobs. Okay. I have mentioned
What level?
earlier to get training post.
What level can we get in? If you have completed your 4 years training in your home country, do you get an ST3 job or CT1 or what?
Let me explain you what is ST3, what CT1. Look, ST means specialty day.
training.
ST
Yes,
means specialty. CT means core training.
yes,
Okay. So I want to tell you, those are coming from outside the UK. It would be better for them to get a ST job, not CT. Okay, ST1 means it's a junior level post, SHO level post, not that much junior, however junior. ST1 and ST2 is a junior level post. ST3 is a mid level post. Like my post is ST3 plus. So ST3 then so if you have 4 years experience, so you are in between ST1, 2 and 3. So you can try for ST3 job, or you will get definitely ST1 job. So I want to tell you one thing. I have mentioned it earlier. If you are very good surgeon, you can do independently lots of surgery independently, then you should try a ST3 level or restal level post, because in the night shift, in emergency duties in the night shift, where there will be no consultant, you will be the boss, you will be the consultant. So if you cannot do independently, so it will be a great shame for at this moment. If
And
you
is there any benefit of doing research?
definitely.
Yes. In
Definitely.
Viva, you will get lots of benefit. They will ask you, do you have any research work? Do you have any presentation? Do
Yes.
you have any publications?
Yes.
This creates points.
Gives merit. Yes.
Merits. These are the merits. If you have this one, you should mention this one. If you don't have this one, then try to acquire these things.
Yes.
And be yourself. Like Sadia, I want to tell you, those are from Bangladesh. Become a member of Society of Surgeons of Bangladesh. Become a member of surgical groups and attend their seminar. Whatever seminar you will attend, they will give a certificate of participation, certificate of attendance, certificate of appreciation. So these are the certificates very much important. Then you can show it to them. You can write down in your CV that I have participated this seminar, this conference,
And
these things.
are there any marks for attending different workshops like ATLS provider
Yes.
course
Yes.
and
It
BLS
will
basic life
in
support provider course and other
CPD. Yes.
definitely,
courses
definitely.
such? Okay.
Everything has a value. It will increase your mark.
CPD points or CME points. These are
Yes,
counted. It shows that how continuously you are learning.
yes.
The more certificates or more achievements you have, the more it shows how
Yes,
increasing.
they will always ask you,
Yes.
what is your future plan?
Yes.
What is your ambition? Do you want to only stick in your job and want to earn money? No, you have to say, I want to be a consultant. I want to be a this specialist. I want to do more degree. I want to involve myself in more study, more research. Then they become more happy. They want to hear these things.
Any advantage of working as a registrar in your country? Does it count as well?
No. This will they will. Yes, they will ask you what was your last post. When you will give your CV, you will definitely mention that I am at present I am working as a registrar in this country. Definitely you should have a present status. This is your present status. This definitely has a value. So
And there are other
I want to give you an advice.
such as
I want
yes,
to
please.
give you an advice for all of them. like I was a consultant in my country for last 8 years, but I have been applying here and work now, got a job in a register level. So always try to decrease 1 point below of your present post. Then it will be better to make yourself adjust here. If you are working in a register level in your country, then try to be a SHO in here. If you are working in a SHO in your country, then try to be a FY2 here. If you are working as a consultant in your country, then try to be a ST3 here. Try to be always 1 level junior post, because this will help you to make adjust yourself here. This is my just personal opinion. Don't take it by heart.
Yes.
Okay. And don't get disheartened because you are dreaming, oh, I have 4 years experience, I will not go without ST3 post, without register. I'm a register here, why I will go without a register post in UK? Then you will not get a job offer, you will become disheartened for 2 year 3 year waiting. But if you don't waste 1 day in your country, if you have decided that I will go to UK, then why you will waste even 1 day in your country waiting for a register post? Because if you apply for SHO level post or junior level post, you will get the same visa, you will come to this country, you will get the almost the salary, you can easily run your family. So why you will waste your time? Most of the people waste their time thinking in their country that I am this in this country, why I will not get the same level post. Don't waste your time by this thinking of that, because you have to, when you will come to this country, it is better to come in a lower post, then get some experience, then you will go to the higher post.
And there is a program, medical teaching initiative in
Yes.
UK, where they offer
MTI.
if they offer you training slots in their programs. So
Don't try. If you want to come permanently or shift with your family in UK, don't choose MTI route, because it's only for 2 years or 3 years. After 2 to 3 years, you have to go back to your country.
Yes, this is the only drawback. But
Yeah, only and most important drawback.
Yes.
You are committed to go back.
For surgical trainees? I meant to ask you, do they give you hands-on practice and hands-on learning in MTI?
Look, it depends absolutely upon you. If you can do, they will observe you. If you can handle, they will give it to you. But if you can, if they observe you and you cannot do properly, then they wouldn't let you do this. Okay. So it's better to get some training in home country, be confident, then you can keep your step here with a big heart. Yes, I know these things. These are nothing for me.
And is there any other country that accepts you as a trainee on the basis of MRCS exam?
Yes, ma'am.
Yes.
What he said.
On the basis of MRCS, accepts many other countries like
yes, in the Middle East. Whole Middle East is
yes.
fond of MRCS. In
Yes.
Middle East, they love MRCS.
In other
Any
UK
country in
colonies,
Middle East, Dubai,
like,
Abu Dhabi,
yeah.
UAE, Saudi Arabia, if you get FCPS, you will then the salary you will get after doing MRCS more double than FCPS or MD.
Yes, even if you try, you can try even Australia, New Zealand. They will also accept it.
I want to tell you this thing.
Yes.
If you work in UK and get JMC registration and
yes.
work 1 year, 2 year UK, then if you wanted to shift in Australia or New Zealand,
yes.
you don't have to appear any exam.
In their exam. It's just 6 months, I know.
Yes.
If they have UK experience of 6 months, it's enough.
Only 6 months.
It will be accepted.
Have UK experience.
Yes.
Everything is accepted in Australia and New Zealand.
Yes, because they have been colony of UK, or they are state.
Yes, and much more salary than UK in Australia.
Yes.
Experience outside UK is not counted in Australia and New Zealand. Is that right?
Outside means like American experience, European experience. Yes.
No.
Outside means your country.
Your home country.
No. has to
Look,
be experienced in
definitely,
any advanced country.
I
Yes.
want to give answer of
Yes,
his
yes, yes,
questions.
yes, yes, please.
Look, nothing is in vain in this world.
Nothing is impossible.
Nothing is in vain. If you can do this surgery confidently, if you say I can do this surgery confidently, if he is a British consultant, he will definitely give it value. Okay, and most of
Okay,
them,
thank you.
if he will definitely give him it to value. So you guys are not listening so attentively, or I cannot. I am not. My English is not that good that I cannot explain you properly. That the British
No,
consultant
no, you
who
are
took,
explaining it very well.
though the British consultants who took my interview, who was the consultant of my interview, they didn't even ask me questions after watching my CV. When they saw that I have lots of experience in my home country, they just didn't ask me any question. They just offered me the job. That, do you mind to work with us? But
Yes.
my countrymen, my neighboring countrymen, was thought that yes, you should have get some experience doing attachment. Attachment means free job. They will not pay me. I have to just do honorary training. Then they will decide I can do this thing or not, whether I have lied to them or not. I can do this surgery. Okay, so there is a definitely value of your home country training and in your home country's training, because surgery is not a bookish thing. Surgery is a art of work. Surgery is a handy things. If you can do it, you can do it. If you cannot do it, will you ever say that I can do it? If you cannot drive a car, will you ever say that I can drive a car? Then if I give you the key, then drive it. Then what will you do?
The moment you'll sit in the car, everyone will know how much you can.
Because the consultant who will take your interview, you will be working under that consultant. So in interview board, if you have said that I can do appendicectomy, laparoscopic appendicectomy, I did lots of laparoscopic appendicectomy by myself. And when you will be working under them, they will be watching you. If you cannot perform well, if you cannot do this thing at night, you are the register at night. You have to do laparoscopic appendicectomy. You are calling your consultant, sir, I have to do laparoscopic cholecystectomy, laparoscopic appendicectomy, and then he has to come. Then, but you told in your interview, but you can do it confidently. Then what will you do? Then it would be a great shame at this moment. So in surgery, this is not like medicine. In surgery, if you have a very good training in your country, if you can do very good surgery in your country, this has a very good value. Very good value.
Dr. Jahangir?
Yes, please.
Sorry, you were saying like, I want to ask one thing. How much of experience do we need in urology to get into ST3, like from our home country?
Look, I am giving an answer to this question. If you have 3 years experience, but you cannot do a cystoscopy, you cannot do a stenting, it has no value.
Okay.
If you have only 6 months training, you can do
Okay.
cystoscopy, you can do DJ stenting, you can do testicular torsion, then you will
Okay.
get the job. You got
Even
my
only
answer?
6 months.
Not even in 6 months. If you can say in Viva board, then I can do
Okay.
individually by myself, cystoscopy, stenting, blah blah.
Okay.
Then he will not even ask you how month training or how years training you have.
Okay.
Then in your first question, first they will ask you go through your CV, what CV you gave them, or most of them ask, tell me about your surgical training, how much surgical training you have. Then you will say that I have 3 years, 4 years, or 1 year surgical training. Then they will ask you what are the surgeries you can do individually. Then
Okay.
and then you will tell I can do this thing. Then he will say, can you do testicular torsion? This is the most emergency in urology. Can you do testicular torsion independently in my scrotal exploration and orchidopexy? And
Okay.
can you do cystoscopy? Can you do DJ stenting? If you say 3 years, then the job is yours, most likely. But if you have 3 years training, you cannot do this thing independently. So you will not get the job. So it doesn't mean, it means nothing. And if you cannot do this thing, suppose you cannot do cystoscopy or stenting, but in Viva board, yes, I can do, then that will be disaster, because you will be working under that consultants.
Okay.
It
So
will be
there is
disaster for
nothing
you,
like,
disaster for your country, disaster for your countrymen, because they will, next time they will not trust anybody, and they will not give job to other people as well.
so there is nothing minimum level of minimum level of months or years of experience you need.
When you are a MRCS guy, then you definitely have some experience in surgery.
Yes,
It is
that's
not
right.
necessary that you have to have that much experience in urology. But if you don't have any experience in urology, how you will do cystoscopy or stenting or torsion?
Right.
This is
That
the
means everything is
requirement.
connected.
Yeah.
So my point is that you definitely have some experience. That's why you are applying in this post. Okay.
Right.
So it is not necessary that you should have 2, 3 years, 4 years or experience. If you can do properly with minimum experience, then it's enough.
Okay.
But my earnest request to all of you, if you cannot that much confident, if your confidence in a consultant level, then apply for a register post. If your confident is a register level, then apply for SHA level post. If your confident is SHA level post, then apply for FY post, FY2 post. Okay?
Yes.
If you overestimate yourself, then you will be waiting for years and years, will not get a job.
Sunny, hello.
Yes. Dr. Suman has a
Yes.
question.
Yeah, Dr. Jahangir, sorry. What about the logbook? Do we have to present the
Yeah.
logbook in which format? Just I want to know.
Okay, my experience is that
For the job.
I
Yeah.
had logbook, but
In paper form or electronic?
Nobody wanted to see it.
Okay.
Yes, ma'am. I had a PDF form. Means
Yes.
last, I was working in the hospital which I worked in my country. It was a renowned hospital in
Yes.
Chittagong. So they had all the records. Whatever I do surgery, there was a special computer operator. She used to take all the notes, all the instructions. So it was just when I said that I need the surgeries I did in your hospital, then he emailed me everything.
Good.
So it was very good if you have a documentation.
Yes.
It is a very good to have a documentation. But those don't have any documentation, don't worry about that much, because you will be applying through NHS job and track jobs or any agencies. It doesn't bother that much, but it will help you in some places when you will get job, when you will involve in this country. Then if you show this logbook, and if you can show by your work as well, you can do very good work and you have a very good logbook, then it will help you in future. Those don't have, try to do it. Those who have it, try to keep it. But it is not that much thing that it will give you everything. Okay.
Like I am maintaining my surgeries logbook, all the surgery, whatever I'm doing.
Yes.
Just
Yes.
in a format, table format in my own laptop.
Yes. Yes. That's the most important thing. And and those don't have this thing. Those have written. So make it scan. Do it scan. Make a scan copy. Make it in a PDF form. It's not that much big.
This Dr. Al Hassan wants to know how he will show his electronic logbook to consultant.
No, if they wants to see it, then you can they will give you email address, you will send it through email.
Yes, but it will be logging in will be required. Maybe would have to take a screenshot and share.
Ma'am,
yes,
nobody wanted this thing.
yes, but they
Experience,
are
what I
asking
saw.
you because they are worried, you know.
And I answered it very nicely
yes,
that
yes,
if
yes.
you have it, keep it. If you don't have it, try to make it, but don't worry about it. It's not that much essential thing.
Yes.
But if you have it, that's good.
Yes.
Don't have it,
Good.
try to keep it from now, because you will be doing more surgeries coming days.
Yes.
So try to have one.
Good.
Try to keep it. Try to have all the documentations and try to do some trainings by this time. Try to do some presentation. Whatever the presentation in your, it may be in your ward, it may be in your classroom, whatever. Try to make a note. I did that presentation on that day on this one. And if you make a presentation in computer, laptop, keep it in a PDF form. Then you can send it as an attachment.
Yes.
People are so smart nowadays. They are doing lots of things. So I cannot even operate a computer properly. So Allah make everything easy for me. That's the thing. And my wife is a master of computer. She made an account me in LinkedIn. She did an account me for Interact job. She did everything for me.
That's nice.
She is just I have to do one thing. I have to do study. I keep studying whole day,
Yes.
and she does everything for me.
That's good.
I am very much lucky in
Yes,
that sense.
that's a good way of appreciation, because you left your whole status and
Exactly,
everything
ma'am.
for her.
I left
So
everything.
I think, yeah. So she's
And the
grateful.
much
That's
salary
good.
the UK government, the much salary they can give, and Sadia knows very well about me.
Yes.
I earned lots of money in my country that this government cannot give me that much money.
True.
So I left everything for my children.
Yes,
for my
Dr.
wife,
Ishfaq, this
my
is
family.
what it's written in one article. They say certificates, previous minimum experience in months. See, this is what Dr. Jahangir was saying. And compulsory
Yes, ma'am.
exam is Mrcs, which you'll be passing very soon, hopefully.
Ma'am,
Then you can work in ST3 plus post. Yes, please.
this is not the hard and fast criteria. Okay.
Yes, this
Look,
is
I can
minimum.
give you. That's why I told Irfan to join, because
Yes.
Irfan was trying for last 9 and 10 months.
Yes.
He got a job just at the same time with me. I got a job
Yes,
with 1 month.
but
He got a
I'm
job.
not sure if he's happy with what the offers he got.
No,
Because
ma'am. Let me
we're
explain
expecting
you.
more.
But he is getting offer in every month. The problem with him is that
That's good.
he always wants to come with a register post, because he has got MS degree and
Yes.
he has got 5 years or 6 years
Yes.
experience in
Yes.
surgery. And the thing is that I'm sharing everything. I mean, he is my fellow brother. Don't it will not be a
Maybe
problem.
not, because I'm recording. So with his consent, you can.
No problem with that, ma'am. If he
Okay.
he creates any problem with me, then I will slap him. He is my little brother, younger brother. I adore him. I owe him. So, and he owes me as well. It doesn't matter. Ma'am,
He's a
if
very
you,
good person.
he is getting
He's a good
job
person.
in
Still,
every
we
month,
shouldn't be
but
discussing a third
he
person who
was
is not
stubborn.
present.
He was stubborn that
That's,
whenever
yeah.
I will get register post, then I will come.
Okay, that's all right. He
And he
should
is
take it
getting job
easy.
everywhere in
That's good.
ST1 level post. Though he has
Hopefully.
MS degree and
Yeah.
experience in 6 year, 6 year or 7 year in
So
surgery.
hopefully he should wait and he'll get the best one.
And he at last he got it, ma'am. And just
That's
last
good.
week he got a job in register level post
That's
in
great.
surgery. And
That's great.
inshallah
Yeah,
he's coming.
that's great. That's great. All right.
The only problem this that's the reason he have to wait. So those people who says that I have been waiting for that much time, I'm not getting any, that's the problem, ma'am. That's the one important
When you
problem.
have to sit and choose,
Yes,
then yes,
I
it
think
becomes, yeah,
yes,
takes
if
longer
your target is to come in UK, so it doesn't matter what post you are getting, just take the visa, take the job, get the visa, come to UK, then work here 1 year. After 1 year you will got a lots of offers, as you have 1 year's UK experience.
Good. Yeah.
So those are thinking of 4 years experience, trying to get register level. With my honest opinion, with my due respect, it will be difficult. Yeah, nothing is impossible. You have to wait long time. Then you will lose 2, 3 year, 1 year, 2 year. So if you can come with SHO level post and work here 1 year, then you will get a 1 year's experience in UK. So this is more beneficial, I think.
Yes.
So Irfan got ma'am 6 offers at least.
That's great. That's great. Wonderful.
And he applied for raster level. He got he interviewed as a raster level, but they offered him. They called him next day. That Irfan is a very talented boy. He's a very nice boy. He speaks very good English. So they offered him, okay, with your experience, and we are all thinking about a junior clinical fellow or ST1 level for you.
That's good.
You mind to join with us? Then he always declined this offer. He has waited and he got his prize ultimately.
That's great. Yeah. Patience pays off.
Yes, and my one interview with that particular person said that you are overqualified for this post.
Okay.
He said that you are overqualified. We cannot take you. Because you are overqualified. So
Yes.
the other British consultant, he was trying to take me. Then he said that no, things are not like that. We are very much interested to appoint you, and when you can join. Then that guy, that our neighboring countryman, gave me an offer about the salary. It is so low that it is one type of humiliating.
Yes.
And he is trying to say that I can go back. I should go back.
Yeah.
He cannot make me fail, or he cannot make me whatever you could rejected, because the another white consultant was there in front of him. Whatever he asked me, I gave all the answers very confidently. So how can he will reject me? That finally my wife says that my another colleague says that you should not work under this consultant because he will give you lots
better
of
not
pain.
to. Yeah.
That's
so
why
much
I declined.
insecure. Yes.
That at first job should be a comfortable one.
Yes. Dr. Jahangir, how was the interview structure? Did they ask you any medicine related questions? Like they gave you scenarios? How would you manage?
Ma'am, you
this?
can if any of colleagues from our members get any job interview or wants to discuss with us, you can say that kindly you can join this group, because me and Irfan, we have lots of experience. Interview questions are fixed questions.
Okay.
Don't even bother for them. These are the very fixed questions. We will tell you all the questions and all the answers. They will ask you these same questions, you will give you the same answer.
Like, is there any difference, like if someone applies for a registrar post and if someone applies for ST3, would there be a difference in question structure or question?
Ma'am, registrar post and ST3 post is same post.
Yes, but would there be any difference in any position?
No,
like
ma'am, these are the same
SHO
questions. And this level,
or
yes, that's the question will be different. SHO level,
yes.
they wants you can assist properly or not.
Okay.
In registrar level, they wants you can confidently and independently do the emergencies or not. You can give relief to the consultant or not. Consultant can comfortably sleep at night by giving everything to you.
Right. Can you name few agencies for Dr. Al Hassan whom he can connect with?
This is not necessary. This is definitely not necessary.
Okay.
Because they will contact you. You need not to contact with any agencies, because when
the moment he'll make the profile,
yes, when you will make a profile in the LinkedIn,
yes,
then you will give a search that recruiting agencies in UK. Then there will be lots of recruiting agencies in the UK. Ma'am, you can give the search recruiting agencies UK. Then you will send them friend request to everyone. Everyone will accept your friend request. They will look for your profile and they will remind you in their mind. When you will give them message that I got my JMC registration or I have completed my MRCS and I have completed my OET, then and then they will contact with you.
Okay.
Hundreds. There are hundreds.
These are top 10. Visit website. Okay, if you'll write like this, you'll get something. Yes, so it will hopefully be easy for you.
Lots of.
Yes.
You
And the
don't
good
need
thing
to.
is you don't have to pay them anything. If anyone contacts you
Nothing.
and asks you to pay them a fee or something, remember, block them. Don't pay them anything, because Dr. Jahangir.
Ma'am, if they open a profile in LinkedIn,
yes,
nobody will ask nothing. This is a very
yes,
much protected, and this is supported by the UK government and different governments, because this is a job searching site,
yes,
and like track job, NHS jobs, these are free also, and these are very much protected, ma'am.
yeah. So it should be all right. Otherwise, we are here. You can knock us and ask us anytime. We'll be happy to help you. Dr. Al Hassan has another question. No, he said, okay, that is great. All right, good. Yes, please. Anyone else
So,
have any question? Yes.
okay, it is at midnight in Bangladesh, most
Beyond midnight.
beyond midnight.
Yes.
So if you have any questions or any queries, you can pop down it in the group. I always follow the group. I always look for what is going on, what will be going on. So I
Yeah.
will definitely give you answers. And I hope today what I have shared, it's all of my personal experience. Don't take it by heart, or and don't make yourself disappointed. And there are lots of jobs, lots of offers here. And it's a great opportunity and great time to catch it. It's a
Yeah.
golden time. When they will be overflowed, or their need will be fulfilled, they will not need that much doctor again. So those who are preparing for MRCS, and after MRCS you will have to give OET or IELTS, so there is a lots of time you have in between. So try to have a very good training. If you can do confidently surgery, then you will secure a job definitely. Those who are
Dr. Salim,
Yes. Yes, please.
when is the Royal College of Surgeons of England announcing its international exam dates, or even other colleges? There has been no
Not
update
yet.
for so long.
Not yet. Because vaccine has been introduced now, according to me, until May, it will be the same, like it had happened in October. And then depending upon the results, how people react, because they gave vaccine and already 2 people had allergic reactions, which they were not expecting. So how things will evolve in next few months, I cannot say anything. But they did mention that Part B can be offered as remote exam, just like Part A has been offered. So just watch out. We will know. I can't say anything.
I heard someone saying that maybe they will be announcing dates for international exams in January 2021,
No.
because their PLAB 2 is also going to be opened by January 2021.
Okay, I have no news. I must say I don't know, because these members who have applied for exam in February, they will definitely get notifications for any seminars or any meetings or gatherings if there is any change. Then they will let me know and I'll inform you. Right
Okay,
now
okay.
it's but I know it's 13 stations and it's a lot more easy to pass exam Part B these days. Less stations and no patient, you just have to narrate your examination, and then result is announced cumulative knowledge and skill. You don't have to pass knowledge separately and skill separately, so that's why.
that's a great opportunity, man.
Yes, I know.
In our
That's
time, I know one of my colleague from Nigeria.
yeah.
He passed in knowledge part with 130. The pass
Yes.
mark was 110.
Yes.
But in clinical skill, the pass mark was 135. He
Yes.
got 130.
Yeah.
Failed.
Failed. That's what I'm saying. So this
But
time passing is a lot more easier.
yes.
they can easily pass if they
Try
appear.
to get this opportunity.
But now you're in a better position. You can
Yes,
tell them
and
how
try
to
to
get the job. Yeah.
come as early as you will come to UK, as early as you can be vaccinated.
Yeah. Right now, 4 companies are
Yes.
offering vaccine.
Now they are
in UK.
offering in in care homes, elderly.
Yes.
After that, they will give all the NHS stuffs.
Yes. Yes. Has your
Okay,
queen
ma'am.
been vaccinated?
Yes. I don't know, ma'am.
She asked for it. I think she did.
She should be vaccinated because she is
Yeah.
about 100 years. So
It
90.
doesn't matter. She'll live 100 more. Her health is better than ours. So yeah, why not? She can still ride a horse just like anyone, like a
Yes,
teenager.
ma'am. Here you will be amazed when you will say that if you in front of your driver, someone is crossing you. That when you look at, especially females, most of them are females. 80, 90 years, they are driving cars, ma'am.
Yes.
And they are driving some Pajero jeeps, like jeeps. They are driving
Yes.
jeeps.
Anyone, yes,
So
everyone.
driving
Yes.
means you have got a control of everything: hand,
Yes.
leg, eyes,
Yes.
ears,
Yes. Yes.
brain, everything. So if
Yes.
anyone can drive, then he is 100% perfect. He or she is 100% perfect.
Yes, but there is a certain age. After that, license doesn't work. They are not supposed to be driving. If they are driving, they are driving it illegally.
Yes. Alzheimer's,
Yes.
dementia.
No. Yeah. Even cataracts, vision goes. So there's certain age. I'm not sure which age, but it's 77 or it's certain age. After that, they are not supposed to be driving. But sometimes they take risks. They drive.
Okay, ma'am. We
All
should
right.
leave
Yes.
now. And
Yes.
ma'am, I am very much honored and pleased that you gave me this opportunity to
Thank
speak
you, Dr.
here.
Jahangir. We are really thankful to you that you
No,
came
no,
out
I
Yeah,
am
and
Dr.
you.
grateful.
Thank
I
you
am
very
thankful
much,
for this
Dr.
group.
Jahangir.
What I have achieved today is
Yeah.
almost Samin Malik is one of the part of it. Eh,
Thank
It is
you.
one of part. So I can never forget. And I always love to come here, share my views. And if you have any questions, please write in the group. I will definitely answer it.
Okay, thank you very much.
Thank you so much. Thank you, everyone. Look, they were
Thank you,
still
ma'am.
sitting and they were listening. They were never wanted to go. So it's, thank you so much. You, all right, it's time. You can. It's 8:30 almost your time.
Yes, ma'am.
So take rest. And then
Thank you.
maybe after spending few months there, then you can maybe come back and tell them how to
Yes,
survive in the UK environment, because environment is also, it's different and it plays a major role.
Yes, ma'am.
Getting
Yes,
a job is one thing, but then settling, because many doctors, they overwork themselves and they get really like fatigue and many symptoms they start showing, and they don't pass in the environment. So that also sometimes leads to many failures.
Ma'am, Dr. Sadia is here.
Yes, she is here.
Sadia, do you
Yeah.
have training in breast surgery? I have heard that you have a training in breast oncoplastic surgery.
Yeah. I
So
have
there is a very good opportunity here, breast and oncoplastic surgery.
Good.
It's a different
I
entity.
know. Yeah. I
So
know
you should,
that.
as you have experience, so you can try on that aspect.
Yeah. Right.
That's good.
You will definitely get a job. You will. I can promise you that if you apply, you will get job within 2 weeks. If you don't get job 2 weeks, I will manage it for you within 2 weeks. I know how to do it.
Okay. Thank you.
Dr. Jahangir, one last question. How frequently jobs are advertised?
Ma'am, jobs advertising every day. When you will open an account in track job or NHS job, it will be automatically updated in your account. You will just open your account. You will see there is lots of job offers. Then you will click one. Then your application will automatically be submitted there. It is a very easy thing.
Yes,
But
I just wanted to make sure. Yes.
Ma'am, but one thing. For NHS and NHS jobs, track jobs, it's necessary to have a JMC registration.
Yes.
Because but the problem is that those are living in outside the UK, when you will get a MRCS and OET or IELTS, then you can apply for JMC registration. But you will not be fully registered until you come to UK, give your photo
Biometric.
identification.
Yeah.
When you will give your photo identification in coming in UK, after coming in UK with JMC, then in JMC website your name will be included. So this thing is necessary for NHS track jobs.
Yes.
That's why those are living outside the UK, it is better for them to have a job with agencies. That's the
Yes.
reason, ma'am. That's the reason you are applying through NHS and track jobs. They are not calling you. They are not. Why they are not calling you? Because they cannot find you in the JMC registration.
Yeah.
Because you have completed MRCS, you have completed OET or IELTS, got JMC registration, but you haven't come in UK for your identification.
Yes. And as long as you are not there, you are not considered.
Yes.
That's why.
Those who has this opportunity, I will recommend you, whenever you will complete your MRCS and OET, just visit with your family, come to UK, get your JMC registration identification, and have a visit in 2 to 3 weeks in UK, then go back to your home country, then apply through NHS and track jobs, then you will get it.
Yes.
But this is an expensive thing, not so
Not that
feasible
easy.
for everyone.
Yeah. But yeah, once in a while, okay, yeah, they can if they want.
This is the one drawback, ma'am. NHS and trackjobs.com.
That's when they don't hear back from the
Yes, that's
jobs
why
have
they
applied
don't
for.
call. The guy who said that I have been applying for 1 year, 2 years
Yes.
through track job, NHS jobs. So they are not calling back because of this thing. They cannot
Yes.
find them these
Very
candidates
important. Yes.
in website. So why Irfan got his job in through track jobs? Because in JMC, when there was a COVID in March, April, May, in that 3 months, JMC made a circulation that no one has to come in UK for their identification. We'll give automatic identification to these peoples.
Right. Okay, that's good.
That's why Irfan got job through track jobs.
That's good. Yes.
Whether
These
everyone
are small things, but they matter
very
a
small
lot.
tricky
Yes.
things.
But they
When you
matter a
don't know
lot.
it, you will. They have people are applying track jobs, applying, but no interview.
True.
Because they are not find. They cannot find you in the JMC website.
True. And the jobs which are which are advertised every day almost, they are enough. Just suppose there are 30 applicants applying. Would there be enough jobs in whole UK for all those to accommodate all those 30 applicants?
No, ma'am. Like for every post,
There'll
some
be
50, 60, 70 are applying. They call interview only for 3 to 5%. When
okay.
you will get a call for an interview, it's a very possibility to get the job because
Yes.
they don't waste that much time. They have
No.
lots of work to do. So they will not take interview lots of candidates and they have not that much. They don't have that much time.
True.
They will take very selective. They ask for interview very selective persons, only 3 to 5%.
Okay, one last question coming in my mind. Is there any place in UK which is not IMG friendly, immigrants friendly, where they should not apply?
I don't have any idea.
Any idea about that? Or where they're...
Ma'am, I want to tell one thing.
Yes.
Those who are coming in the first, there is a lots of jobs in the Northern Ireland. It's a UK, Belfast.
Yeah.
That at the 7th day of my registration, someone said that if I want join, I can then and then join the Belfast. So it is 10 hours drive from my house. It will not because I came so far for my family, so I cannot leave.
Yeah, I understand. It's just I'm asking for them. So
Yes,
if there is any place which is not
some islands,
friendly, yes.
all the islands, man. So for the beginners, those wants to come in UK, they can take these offers. But you have to just get the visa to enter the UK. Then after 6 months or 1 year, you can change your place. There will be lots of offers when you have UK experience.
What about in Scotland, like
yes,
Edinburgh and Wales? Jobs are available readily?
Yes. And at present, jobs are available everywhere.
Everywhere. Okay.
For medicine people,
Yes.
those in medicine, they are getting job within 2 weeks. Within 2 weeks, they are
Nice.
getting. Those
Yes,
were
but these are
respiratory
surgeons,
medicine,
you know, they
acute
have to
medicine.
consider, yes,
Yes. For
their route is
surgeons,
different, yes.
yes. For surgeons, ma'am, the important point I have sought out today. These
Yes.
are the very remarkable. First,
Yes.
you have to know where you have to apply. Like if you have 4 years experience, I will recommend you have to apply SHO.
Yes.
And you can apply register post as well, but don't stick with it. You have to be flexible.
Yes. And the rest is all luck, definitely.
Exactly, ma'am.
Yeah,
Everything
good.
at last, everything you will try, and what will happen, that will be written in your life.
True. All right. Anyone else have any question, or should we call it the end? Thank you so much.
Thank you, ma'am.
Thank you,
You,
Dr.
everyone.
Jahangir. You came, you gave us your valuable time, valuable advices, and
Thank you, ma'am.
sincere,
I'm always happy to come here.
suggestions. And
Yeah,
yeah,
thank you, Dr. Jahangir.
thank you
Thank you,
so much.
everyone.
We wish you all the best in your future endeavors.
Yeah.
Thank you very much. Thank you.
Thank
See you
you.
soon. Hopefully.
Yes, hopefully.
Okay, ma'am. Thank you, ma'am.
Thank
Bye
you.
bye.